The fetus really responds to the maternal nutrition, and if there is a lack of important ingredients in the diet, the fetus will reprogram his whole cardiovascular system, and this has lifelong consequences. It's called fetal origin of adult cardiovascular diseases. This is the association of high blood pressure, myocardial infarction, stroke, with a low birth weight, for instance. So the fetus can adapt to this bad environment with strategies that enable short-time survival, but long-term problems. So there is no more important period in life than the period before birth, because it reprograms your whole system.
And I guess we could also say that pre-conceptually, it's very important for the mother and the father to be in healthy shape as well, vis-a-vis these factors.
Absolutely, absolutely. Preconception, this has a lot to do with folic acid, I told you, increased homocysteine. You can inject homocysteine in mice and it can create all kinds of cardiac defects with that. So you want to be sure to have a very low homocysteine level and enough folic acid.
That's amazing.
Yeah.
So really, when we advocate for a product like Juice Plus, you know, we really are, on a long-term basis, impacting the potential for not just the person taking the product, but if they're going to go on to have their own children, the health of the family going forwards and into the child's old age. That's quite remarkable. You mentioned congenital heart issues in babies, and I know that you're one of the, well, I think the first doctor to do a pulmonary valve procedure on a baby still inside the mother. Now, I can't think of, yes, I can't think of anyone else that I would trust. If I had a wife and a baby that needed that kind of intervention, Dr. Tulsa is one of the only people in the world I would trust to do that. Now, here we have him on our panel, and his trusted advice as it relates to nutrition and well-being from a cardiovascular perspective, we can absolutely trust what this gentleman is telling us. And what I find really interesting also is that a lot of the doctors that we have associated with our company are very, very impressed by the research that the company has done over the years. And we were going to have Manfred Lamprecht with us today, and you know, he's done an incredible job for the company. Gerald, what would you tell us about how important the research is? I mean, when we're talking to colleagues, and there are quite a few of the healthcare practitioners in the audience today, and we had an excellent meeting at the hotel yesterday. We were looking at the research and how important it is, and how to attract more doctors to be confident to recommend our product. We need them to understand what the research is telling us. Why was it so important for the company to invest in that research?
Well, we as physicians, you have a great responsibility about what you're talking to your family and to your patients. And it's not enough just to have a few testimonials. Well, I took it, it was great, and I feel better. Just, which is okay, but it's not enough for a physician to really go into a strong recommendation. We need not to think that it might be good, we need to know that it's good. So I'm myself a data-driven person. I need facts and I need clear evidence. And there is no other way to get this evidence than clinical studies. And I'm talking about real clinical studies, not company-sponsored outcome-driven studies where you already expect the outcome.
So can you explain for the audience that don't understand what a real clinical study, what it looks like in terms of gold standard peer-reviewed evidence, can you just explain a little bit about how those studies are conducted? And you know, we have a very high impact score in the medical world looks at the Juice Plus studies, and we've got an incredible story to tell. Can you just explain exactly why it's so important that the studies are done correctly on the product that we actually ask people to try?
Yes, of course. Well, I've published several studies myself, so I know how difficult it really is to conduct a real world study that provides some evidence. First of all, you have to write a protocol, exactly knowing why you're doing the studies, what outcome are you expecting, and so on. And this has to go through an ethics committee who will clearly check if this is a correct study, but most importantly, that the subjects that you are investigating are protected. It doesn't harm anybody, and there is a huge effect on new knowledge that comes out. Then once you have this ethics committee, then you're starting recruiting patients, you have to choose the right methods, you have to do all the analysis, you get the results, you write up the paper, and the study design is, of course, incredibly important. For having a chance to get in a good journal, you need a controlled study. What means controlled study? I mean, you have a control group. One group is getting the Juice Plus, the other one is getting a placebo. So you can control what the Juice Plus is really changing in one population or the others. And if you want to be real sure, you have to do it double blind, which means, not that you're closing your eyes, but you don't know which group is taking the real product, which group is taking the placebo. And also the doctors that do the analysis, they don't know which group is which. And even when the analysis is done, then the seal is broken and you know which one is right. So this is a placebo-controlled double-blind study, which provides the highest evidence and the most reliable results. But that's not all. Then you have to get it into a real good scientific journal, and that's the hardest part. What's a scientific journal? Well, you send your manuscript to a journal and they will review it. We call it peer-reviewed. It goes out to 3 or 4 experts in this field, and they will check exactly if everything was done right. The methodologies, the statistics, the outcome, interpretation of the results, and so on. And once this is done, it will be accepted and published. But these medical journals, these high-ranked medical journals, they have an acceptance rate of mostly only 10–15%, which means 85 to 90% of the papers being rejected because they are not good enough to be published there. And this is the impact score that you mentioned. Impact means that's the impact the journal has on scientific knowledge. The higher the impact factor, the higher the more difficult, of course, it is to get into this journal. And that's something that impressed me from the very beginning, that this company was ready to provide the product to independent universities to do research on the product, which is absolutely amazing because you have no control about the outcome. Once you've started this study, they can publish, it's rubbish, it doesn't work, it has side effects, and what else?
That takes confidence,
yes,
doesn't it?
Absolutely, yeah. And it's not one study, not 2 studies, these are 48 studies right now that are out being published. And the impact score of 1 is already very high. Impact score of 2 and 3 is really high for sure. But the cumulative impact factor of all the studies is over 100, which is absolutely amazing and incredible. And
we need to applaud that. That's amazing, guys.